In recent days, the city of Los Angeles has faced a devastating fire that has affected multiple areas of the region. According to local and national media reports, the fire started on January 9, 2025, likely due to extreme weather conditions or human negligence. The flames spread rapidly due to the combination of high temperatures, low humidity, and strong winds characteristic of the season. So far, more than 14,500 hectares have been razed by the fire. Firefighters have worked tirelessly to contain the fire, which has endangered not only infrastructure and property, but also the lives of thousands of residents. Mandatory evacuation has been implemented in various areas, displacing thousands of families from their homes. Authorities have declared a state of emergency, mobilizing state and federal resources to combat the blaze. The ecological impact is also considerable, as the fire has devastated protected natural areas and severely affected local fauna. This fire once again underlines the challenges posed by climate change and the need to strengthen prevention measures. The fire in Los Angeles has left a worrying toll of human casualties. So far, authorities have confirmed the loss of at least 16 lives, while dozens of people remain missing. Emergency services have treated hundreds of injured, many of them suffering from burns, smoke inhalation, and injuries related to hasty evacuations. Among the victims are residents who failed to evacuate in time, firefighters who were injured fighting the flames, and vulnerable people such as the elderly and children. Local hospitals have reported a significant increase in admissions related to the fire, leading to an overcrowding of medical services. In response, temporary hospitals have been set up, and reinforcements of health personnel from other regions have been requested. Stories of heroism have also emerged amid the tragedy. Rescue teams have worked tirelessly to save lives, even in extremely dangerous conditions. Despite these efforts, the death toll could rise as search and rescue efforts continue in the affected areas. The fire has caused significant material damage in Los Angeles, with hundreds of homes completely destroyed and many others partially damaged. Initial economic losses are estimated at $55 million, a figure that could rise as more detailed assessments are made. Infrastructure has also suffered serious impacts. Several major roads have been closed due to the flames, making evacuation and access for emergency crews difficult. Power lines have also been damaged, leaving thousands of homes without power. The disruption of basic services, such as drinking water and telecommunications, further aggravates the situation for affected residents. The impact on local businesses is also considerable. Many businesses have closed their doors, and industrial areas near the fire have suffered damage that could take months to repair. Authorities are working to assess the full extent of the damage and plan reconstruction efforts. The fire has triggered a series of health emergencies in Los Angeles. Air quality in the region has reached dangerous levels due to the high concentration of smoke and suspended particles, which represents a significant risk to public health. People with pre-existing respiratory conditions such as asthma or COPD are especially at risk, and hospitals have reported an increase in consultations related to respiratory problems. Authorities have issued health warnings, urging residents to stay indoors and wear masks if they need to go out. In addition, prolonged exposure to smoke can have long-term health effects, including an increased risk of cardiovascular disease. The situation has also put enormous pressure on local health systems. Hospitals are operating at the limit of their capacity, and medical teams are faced with the double task of caring for direct victims of the fire and those affected by the resulting health emergencies. Evacuation shelters have also posed health challenges, with concerns about the risk of outbreaks of contagious diseases due to crowded conditions. In response to the emergency, significant resources have been mobilized to fight the fire in Los Angeles. Firefighters, supported by helicopters and tanker aircraft, are working to contain the fire. State and federal authorities have provided additional funding to support these efforts, including the acquisition of specialized equipment and the hiring of additional personnel. Shelters have been established for evacuees, providing food, water, and basic medical assistance. Non-governmental organizations and volunteers have also played a crucial role, offering logistical and emotional support to those affected. In addition, private companies have donated resources such as food, clothing, and personal protective equipment. International collaboration has also been notable, with several countries offering technical assistance and resources. This includes the deployment of fire management experts and the dispatch of specialized teams to assist in containment and rescue efforts. Despite these efforts, the scale of the fire represents an unprecedented challenge. Authorities continue to urge the public to stay informed and follow safety recommendations while working to bring the situation under control.